My dear friends, in the last sessions we have discussed systemic fungal disorders, and we have discussed a good number of conditions coming under systemic fungal diseases. Today we can discuss a completely different topic, that is core pulmonale. In the classes I have discussed what is core pulmonale. You might be remembering that. And what actually is core pulmonale? We can simply define core pulmonale as heart disease secondary to lung disease. Heart disease secondary to lung disease. It is otherwise called pulmonary heart disease. Then, how can you classify core pulmonale? There is a classification. We can divide core pulmonale into acute, subacute, and chronic. In the acute presentation, the main condition coming is acute pulmonary embolism, and the subacute, again, there are asphyxial conditions like acute or chronic bronchitis, then severe asthma, etc. Then malignant conditions like miliary carcinoma, lymphatic carcinoma, etc. All these come under subacute classification. Then there is chronic core pulmonale, that is the third division, chronic core pulmonale also, that we will discuss later. So we can classify core pulmonale into acute, subacute, and chronic. Then we can move on to pulmonary embolism. That's the acute presentation. Pulmonary embolism. You might have studied pulmonary embolism, or you have studied about embolism in pathology in detail. In general pathology, you might have heard of embolism, different types of emboli. When embolism happens in the pulmonary vasculature, then we can term it as pulmonary embolism. Occlusion of pulmonary artery or its branches by emboli constitutes pulmonary embolism. That's the one-line definition for pulmonary embolism. Occlusion of pulmonary artery and its branches by emboli constitutes pulmonary embolism. And we can go into the basic pathology, how emboli is formed, or what are the types of emboli which can produce pulmonary embolism. The most common, or it's most commonly results from detachment of vascular thrombus, mainly from leg veins. That is about 70 to 80% of thrombus comes from lower leg veins. So the majority of pulmonary embolism is constituted by thromboembolism, or by thrombus or blood clots. So in that, 70 to 80% comes from lower leg veins. Then about 10 to 15% come from pelvic veins also. Then there are other types of emboli other than this thromboembolism. You all know, for example, amniotic fluid embolism is there, placenta embolism is there, air embolism, then fat embolism നമ്മൾ പറയുമ്പോഴത്തേന് ശരിക്കും മേജർ ആക്സിഡൻസ്, ബ്രോണൊക്കെ ഫ്രാക്ചർ ചെയ്യുന്ന ആക്സിഡൻസിലൊക്കെ യൂഷ്വലി ഇറ്റ്സ് എ കോംപ്ലിക്കേഷൻ. ഫാറ്റ് എംബോളിസം, ഫാറ്റിൻ്റെ ചെറിയ പാർട്ടിക്കിൾസ് അല്ലെങ്കിൽ ക്ലസ്റ്റേഴ്സ് ഒക്കെ ഫോം ചെയ്തിട്ട് സിസ്റ്റമിക് സർക്കുലേഷനിൽ കൂടെയൊക്കെ അല്ലെങ്കിൽ വെയിൻസിൽ കൂടെയൊക്കെ സർക്കുലേറ്റ് ചെയ്യാം, റിസൾട്ടിങ് ഇൻ embolism, fat embolism. Then tumor emboli can be there, and that the most important tumor or the tumor which involved in embolism is choriocarcinoma. Then certain parasites can also cause embolism. For example, schistosomiasis. That again we can see embolism, emboli formation. Then there is septic emboli also. Septic emboli originating from endocarditis, site of endocarditis. So this endocarditis affects mainly the affecting the tricuspid valve. In that there can be septic emboli. So these are the common types of, or the common source of pulmonary embolism. So most important one is thromboembolism. Then air embolism is there, fat embolism is there, placenta, then tumors, parasites, septic emboli. These are the different types of emboli. Then what are the conditions which can predispose to pulmonary embolism? There are certain predisposing factors which can lead to pulmonary embolism. Which are they? Let's go through the reasons or predisposing factors. First of all, prolonged immobilization. ഇപ്പോൾ ഏതെങ്കിലും ഒരു പേഷ്യൻ്റ് നമ്മൾ കുറേ അധികം കാലം ബെഡ്രിഡനായിട്ട് കിടന്നിട്ട് ഓൾ ഓഫ് എ സഡൻ ഒരു 1 month or 1.5 month ഒക്കെ ബെഡ്രിഡനായിട്ട് കിടന്നിട്ട് വി ആർ ട്രൈങ് ടു ആംബുലേറ്റ് ദ പേഷ്യൻ്റ്, അല്ലെങ്കിൽ പേഷ്യൻറ്റിനോട് എണ്ണിച്ച് നടത്തിക്കുക ഫിസിയോതെറാപ്പിക്കൊക്കെ വേണ്ടിയിട്ട്. ഫോർ എക്സാമ്പിൾ ഇൻ ഫ്രാക്ചേഴ്സ് ഇൻവോൾവിങ് ലോവർ ലിംസ്, ഫ്രാക്ചർ ഓഫ് ഹിപ്പ്, വെർട്ടിബ്രൽ ഫ്രാക്ചേഴ്സ്, അല്ലെങ്കിൽ മൾട്ടിപ്പിൾ ഇഞ്ചുറീസ് ഒക്കെ വരുന്ന ആക്സിഡന്റ് കേസസിലൊക്കെ വെൻ യു ട്രൈ ടു മൊബിലൈസ് ദ പേഷ്യൻറ്റ്, വൺ ഓഫ് ദ complication coming is this detachment of emboli can result in pulmonary embolism. So prolonged immobilization resulting from medical ailments, then after surgery or trauma, particularly involving pelvis, abdomen and lower legs. So അതാണ് ഒരു ഫസ്റ്റ് പ്രീഡിസ്പോസിങ് ഫാക്ടറായിട്ട് നമുക്ക് പറയാൻ പറ്റുന്നത്. പിന്നെ ഡിസീസ് ഓഫ് veins involving lower extremities, primary disease of veins. Then congestive cardiac failure is another reason. Then pregnancy, another reason. Then use of contraceptive pills. So when we use, or when ladies use pills for a long time, it will increase the incidence of pulmonary thromboembolism, especially in the age group of 35 to 45. There is an increased risk of emboli formation. So women taking oral contraceptive pills for a long time, that's one reason. Then obesity itself is a reason. Then systemic malignancy, then certain hematological disorders are there, polycythemia vera, then chronic myeloid leukemia, all this can lead to pulmonary embolism. Then heat stroke, other reason causes like heat stroke, massive burns, shock, etc. All these are predisposing factors. So these are the important risk factors or predisposing factors which can lead to pulmonary embolism. Then we can move on to classification of pulmonary embolism. How can we classify pulmonary embolism? We can divide pulmonary embolism into 3 depending upon the size of the emboli. That's very important. We can divide pulmonary embolism into 3 categories depending upon the size of the emboli. So when the size of the emboli is very large, it can lead to massive pulmonary embolism. That's the first group. Here the emboli is lodged in the central pulmonary artery itself, causing obstruction to 50% or more of the pulmonary arterial tree. So the clot is settling at the bifurcation of the pulmonary trunk itself, completely or partially blocking the 2 pulmonary arteries, right and left pulmonary arteries. So the lungs won't get enough blood from the ventricle. So that is massive pulmonary embolism. That's the first category. It's a large embolus, very big embolus. It's otherwise, that embolus is otherwise called saddle embolus. Saddle embolus, correctly fit in at the level of bifurcation of pulmonary artery. Then if the size of the emboli is medium or moderate, this emboli can travel to one of the pulmonary arteries, maybe right or left. It can move towards the direction of the lung and can block one of the arteries, maybe supplying one of the lobe or something like that. And it can lead to a condition called pulmonary infarction. It is very similar to myocardial. You might have heard of myocardial infarction. When an artery or blood supply to a particular area is cut off, it can lead to infarction. In lungs also, when a particular area of lung is devoid of blood or the blood supply is cut off, then it can lead to infarction. You all know, like the heart, lungs also belong to an organ having dual blood supply. Heart is having dual blood supply, one which supplies the whole body, that is systemic circulation, and supply that give blood to the heart muscles itself. So there are two types of supply in heart. Then in lungs there are, again, it also has dual circulation, that is pulmonary circulation, which is supposed to be utilized for aeration or oxygenation of air, then oxidation of blood, then pulmonary circulation and bronchial circulation. Bronchial circulation is mainly meant for supplying blood to lung tissue itself. So there are two types of circulation, and there is communication between these circulation also. If one supply is completely cut off, some amount of blood is compensated. So when pulmonary or when the bronchial artery is cut off, some amount of blood is used from pulmonary circulation also to help oxygenation of the lung tissue itself. So when the emboli size is medium or moderate, it can lead to a condition called pulmonary infarction. Then the third category is microemboli. Microemboli, or if the emboli is very small, it can lead to a condition called pulmonary hypertension. This emboli is very small and will be numerous microemboli can be there. It can lodge diversive pattern, leading to resistance to blood flow, leading to increased resistance to blood flow, giving rise to pulmonary hypertension. So these are the three categories of pulmonary embolism depending upon the size of the emboli. So massive emboli can lead to massive pulmonary embolism. Then moderate or medium-sized emboli can lead to pulmonary infarction. Then microemboli can lead to a condition called pulmonary hypertension. So that's about the classification of pulmonary embolism. Then we can go into the pathological and clinical presentation of these three types of embolism.